Hi, I'm Dr. Lisa Dawson from What the Cancer. Thanks for joining us today on either our website, whatthecancer.com, on Spotify, Apple Podcasts or YouTube. Make sure that you follow us on Instagram at What the Cancer and like us on our Facebook page. I hope you enjoyed today's episode and that we equip and empower you on your cancer journey. Welcome back to episode 3 of What the Cancer. Today we're going to talk about the benefits of exercise. I hope that you enjoyed our podcast on sleep last week. Sleep's so foundational to everything else that we're going to talk about, although all the other things we're going to talk about are also really important in helping us sleep. So everything just works together. Unfortunately, I haven't been able to have that interview with Andrew yet, but he has written us a blog and we're uploading that to the sleep episode. So you'll be able to go to the website and read Andrew's blog on what normal sleep is. We're looking forward to catching up with Andrew later in the year. Tonight I'm flying to Arizona for the Integrative Oncology Conference. This is a really exciting new society for oncologists who want to combine both complementary and conventional medicine. Integrative oncology brings together both evidence-based conventional medicine and evidence-based complementary medicine, so that you know if you're receiving integrative oncology treatment, you're not getting into an area where you can't really trust what the information is. An integrative oncologist will bring you only evidence-based information to help you make decisions about the way that you want to do your cancer journey and help yourself. So hopefully I'll be able to bring you some really good information from that conference, maybe some interviews. We'll see how we get on. So this week we're going to talk about exercise. Exercise is so important in helping us prevent cancer. We know from population studies that people who exercise have a much lower cancer risk and are also likely to live much longer. On average, people who exercise regularly live at least 10 years longer than those who don't. Also, cancer rates vary amongst the different cancers, but for most cancers, they are reduced by exercise. We know that bowel cancer is reduced by 50% and kidney cancer is reduced by 70%. What's more, if you've had a diagnosis of cancer and had curative treatment, you'll know the risk that your cancer can come back. In a meta-analysis recently of both breast and bowel cancer, it was found that people who exercised before they got a diagnosis, and what's more, people who exercised after they had a diagnosis, reduced their risk of relapse by up to 42%. Why does exercise work so well? Well, we have a number of scientifically plausible reasons that exercise works well. First of all, one of the most interesting things is every time you make a hormone or a building block for your body or a chemical messenger, your DNA has to be copied to make that protein or whatever. Or if the cell is going to divide, all the DNA has to be copied. There can be mistakes made in that copying, and that can create mutations which can potentially promote cancer growth. There's a special protein in your nucleus that goes along and checks all the copying and fixes up any mistakes. This prevents cancerous proteins being made. This protein's called P53, and what they found is that the more you exercise, the harder P53 works. So if you're exercising regularly, it's more likely that you're going to be heading off any cancerous cells before they're even made. Exercise also reduces a number of hormones which we know are pro-cancerous. High insulin levels, high cortisol levels, both are promoting a cancer environment. Insulin in particular and insulin-like growth factor are like an accelerator on cell growth. Cortisol increases inflammation and suppresses your immune system, and exercise reduces all of these hormones. Exercise also potentiates your immune system, so your immune cells that are fighting and taking out any cancer cells are working so much better. Exercise also promotes sleep when we know your immune system is working better too. So it's a double-edged sword in improving your immune system. What's more, exercise gets your blood circulating around your body so that you get your immune system where you need it. If you're not exercising, there can be various parts of your body that get poor circulation. Not only does this increase the pH, which promotes cancer growth, it prevents your immune cells getting in there and taking out those precancerous cells. If that's not enough, exercise also significantly reduces inflammation. It improves your gut bacteria, which further reduces inflammation. And we know that a good gut bacteria, which we will talk about in later episodes, is very protective against developing cancer. And a good gut bacteria also promotes good response to treatment if you've got cancer. Other ways that exercise can help are that it can help you reduce your weight or control your weight. And we know, as we talked about in the last episode, that obesity is a big risk factor for cancer. Exercise also helps you build muscle mass, and muscle contains little organelles inside your cells that make energy. They're called mitochondria. And the more muscle you have and the more resistant exercise you do, the more mitochondria you have and the more energy that you're able to make. Cancer and chemotherapy and chronic ill health significantly reduces the number of mitochondria that you have, and so you're likely to have a lot more fatigue. You can combat this by building muscle with exercise, particularly resistance exercise. Exercise also improves your self-esteem. It reduces anxiety and depression and has been shown to significantly reduce the side effects from chemotherapy. In fact, people who were put on an exercise program were far more likely to complete their chemotherapy due to less toxicity, and this gives a better outcome all round for your treatment. So what sort of exercise should you do? Well, you need to find something that you really enjoy doing, because you're not going to keep up doing something that you don't enjoy. When it comes to exercise, anything's good. You just need to move. First of all, you need to move as much as you can throughout the day. Just getting up from your desk, maybe walking to get your coffee or lunch, walking around the office, preventing long periods of sitting is really important. In fact, it was shown that people who spend several hours a day just sitting watching TV had significantly higher cancer rates and other chronic ill health such as blood pressure, heart attacks and diabetes. The second thing is you need to try and get at least half an hour of aerobic exercise a day. So it doesn't matter what you do. It can be brisk walking, jogging, playing team sports, going to CrossFit, yoga, Pilates, whatever you enjoy, but try and do that half an hour every day. Ideally, you want to do exercise that isn't going to increase inflammation in your body. We know that really hard workouts can increase inflammation. You might have heard about high-intensity training, which is short periods of high-intensity exercise interspersed with rest or easier exercise, which reduces the amount of inflammation in your body. There is such a thing now as a clinical exercise physiologist. These are kind of like personal trainers, but they do a 3-year degree in prescribing exercise for people with chronic disease. If you're not sure what sort of exercise program you need to do and you really want to get it right, you could seek out a clinical exercise physiologist. They'll do a full program checking your lung function like they do with athletes, your heart and your muscle, and look at your average day and what you're able to do. And then they're able to prescribe a very specific exercise program for you. This is shown to be extremely effective in helping people with chronic disease. And I've been referring some of my patients with really great results. The third thing that you ideally need to do is a couple of times a week minimum, more if you can, spend about 15 minutes doing resistance exercise. Like I said, building bone and muscle mass significantly improves your sense of well-being, your energy levels, and also helps your immune system. This can be any kind of resistant exercise. You might decide to do some home exercises. There's something called the Big Army 5 where you do squats, planks, some push-ups, some lunges. Or you might decide to go to the gym and get a program. Pilates is really great, CrossFit, anything where you're using your muscles. Well, that's about everything. I just want to really encourage you to try and make exercise just a natural part of your life. It takes 6 weeks to make a habit, so it might be hard work at first, but once you've made it a part of your routine and a part of your life and something that you enjoy, it will get easier and easier. And as you start to link feeling well with your exercise, you're more likely to want to do it. So good luck. I'm going to hopefully bring you some information from Arizona during the week, but we'll be back next week for episode 4, and we're going to talk about diet.